quote, the biggest change to how the state handles mental health in decades, end quote. That's how Governor Gavin Newsom described Proposition 1 after it narrowly passed last night. Good evening. I'm Ryan Yamamoto.
And I'm Elizabeth Cook. The highly contested measure is meant to create more treatment beds for people struggling with addiction and mental health issues. It took more than 2 weeks of counting ballots for the results to be finalized. And you can see why. The final count separated by less than 30,000 votes, which is just fractions of a percentage point. And looking at which regions voted yes versus who voted no, it follows basically the same breakdown as all the results from the elections, with the more highly populated coastline voting yes, with a few exceptions, and the more rural parts voting against it. Now, critics say it's just throwing more money at a problem that Newsom and the legislature have failed to fix or improve for years.
And our Kelsi Thorud has details on what this means for the state.
In what was a much closer than expected election, one that took more than 2 weeks to call, California's Prop 1 has officially passed. Hitting the ground running Thursday, Governor Gavin Newsom, one of the main proponents of the ballot initiative, told voters they wouldn't regret their decision.
What I would say about Proposition 1 is you will be proud. That's exactly what this initiative brings. Fundamental reforms.
Prop 1 looks to tackle the state's homelessness crisis by reforming the 2004 Mental Health Services Act, now requiring counties to spend 60% of the funds received from that act on housing and programs for homeless people dealing with serious mental illnesses or substance abuse problems. The proposition also authorizes the state to borrow close to $6.4 billion to build over 4,000 housing units, adding close to 7,000 mental health and addiction treatment beds. Mark Cloutier is the CEO of Kaminar, a local behavioral health provider. He's been a supporter of Prop 1 since the beginning and believes it will really help get people the treatment they need.
Housing first, which is getting people housed who've been unhoused, is an important first step to stabilizing them to get the appropriate behavioral and physical health care that they need.
But Mark Salazar, CEO of the Mental Health Association of San Francisco, isn't so optimistic. He's worried Prop 1 will force more people into involuntary treatment. He also says the restructuring of the Mental Health Services Act will lead to significant cuts in funding to preventative and voluntary behavioral health programs across the state, including his own.
We can manage as an organization, but there's many other organizations that cannot manage it who are, smaller and really focus on really specific target groups or populations that cannot manage it. Will likely either lose funding or just close its doors itself.
And Governor Gavin Newsom says the new funding supplied by Prop 1 could roll out to cities and counties across the state as early as this October. Mayor Breed in San Francisco says her team is already working on a plan to allocate that money as soon as the city gets it.
Now, earlier today, I spoke with Bishop Bob Jackson from Oakland, who says he hopes Prop 1 will help Oakland and cities like it address not just homelessness, but open police and other law enforcement up to focus on crime.
A big shout out for the governor for sitting in the California Highway Patrol, and they've been doing a wonderful job working, but they're not here to stay. So these things are just a Band-Aid. What's going to happen when they leave? So anyway, big shout out. He's doing something now. That's what's important. But looking at the long term, what is in place for the homeless people, for the safety of our city, and just making our city safe.
Now, before Prop 1, California had spent nearly $20 billion over the last 4 years to try and tackle the issue of homelessness. But in that time, the number of homeless people in the state has risen nearly 40%. And with last year's total of 181,000 making up 28% of all unhoused people in the country. But all those numbers are thought to be underestimation, since it's difficult to get an accurate count of the number of people living on the streets at any one time.